Hey guys, it's Kate here with the AAFE Med Spa. As you can see, we're doing some tox on this patient. I'm starting off by treating one side of the forehead and moving over to the other side. So as you can see, I'm going back and forth between that top and bottom. I'm injecting at a 45-degree angle, about half needle depth. Your needle should glide right into the tissue. If you're meeting any resistance at any point, it's because your needle is either too deep or too superficial. So make sure you're paying attention to that. I'm being very mindful that I'm injecting all the way over to the lateral border on the opposing side, just because I want to prevent my patient from getting any type of spocked brow. So always treat over to that lateral border and be thorough through your injections. Moving on, we're then going to inject the procerus. So this is part of the glabella complex. The glabella complex is made up of 5 different muscles, the procerus, and then the medial and lateral corrugators on each side. There's 5 muscles completely in this muscle complex, so keep that in mind. When you're injecting it, the depth is different for all of the muscles. So your procerus is going to be a 90-degree injection, 3/4 to full needle depth. Your medial corrugators are going to be 3/4 needle depth, and your lateral corrugators are going to be a true half. Just because that frontalis lays underneath those lateral corrugators, and we do not want to drop a brow by hitting that frontalis. Moving on, we're doing a brow lift on each side. I usually have my patient animate so they close their eyes as tight as possible so I can figure out where I would like to treat that in order to get them the optimal amount of lift. Here I am treating the crow's feet. I'm always treating the crow's feet over that orbital rim. As you can see, I'm up and away from the eye. I always want to make sure I'm up and away from the eye so that I am making sure that my patient's safety is my priority, and I'm always over that orbital rim to make sure that I am in the right location. You don't want to be too medial in the face just because we have those smile muscles. You have your zygomatic major and minor in there, and if you're at the wrong depth or you're at the wrong area of treatment, you might compromise those muscles. So just keep that in mind, stay over that orbital rim, and stay always up and away from the eye. Something that I do to help me is I tent up on the tissue, pull it taut so it's easier to inject. Next, we're doing the nasalis. As you can see, I had my patient scrunch like a bunny. I am holding off that LLSA end with my finger there, and I am injecting on the bridge of the nose. These injections should bleb. You want them very superficially in order to target that muscle. Moving on to lower face, we're injecting the DAOs. So I instruct my patient to show me her bottom teeth, and I'm injecting at the base of that muscle towards that mandible to really hone in on the strength. Moving on to the mentalis, I have my patient make a pouty face. I'm assessing where that main dimpling is, and then I am injecting that.